Good afternoon, and welcome to St. Joseph's University's Unlimited Learning Series. I am Asmeret Easley from the class of 2010 and 2021, and I will be your host today. 2020 has disseminated the various concerns in our country. Today, we will discuss and hopefully leave with meaningful support around mental health and education. When we consider the two topics and the current impact of the COVID-19 crisis, we realize that students, parents, and school teams are trying clever and purposeful means of instructional practices. I'm joined today by our two experts. First, Dr. Angela Rowe McDonald, Dean of the School of Health Studies and Education at St. Joseph's University. Dr. McDonald is an accomplished higher education administrator, faculty member, and mental health counselor. Our second expert today is Dr. Jarabri Whitehead, alumni of 2017, principal at Chatham Park Elementary School in Haverford School District. Dr. Whitehead comes with 20 years of experience as an educator in K-12 in Maryland, New Jersey, and Pennsylvania, and with 13 years in school leadership. Dr. Whitehead has spent his career dedicated to the growth of his students and community. I would like to thank St. Joseph's University for coordinating today's event, and thank you all for taking out your time to attend today. A key element of the St. Joseph's University's mission is a commitment to lifelong learning. That mission has led to the creation of the Unlimited Learning Series and today's interactive discussion on the role of mental health in education. But before we jump into our main content, to further frame our conversations, we welcome attendees to take part in our first anonymous poll question that will pop up on your screen momentarily. Thank you to all our attendees who submitted questions during registration. We will address some of the questions later in the hour. If you have any questions during the course of the webinar, please feel free to place it in the Q&A feature below on your screen. All we ask is that you please include your name, location, and graduation year if you are an alumni. At this time, I would like to introduce St. Joseph's University's Megan Burt, who will be assisting behind the scenes with the poll questions in the live Q&A session. Megan?
Hi, everybody. Looking forward to your questions. Thank you.
All right, and it looks like our poll results are in. Most people that have responded that are primary motivators to attend this session are teachers or school administrators or parents of school-aged children, and also we have mental health practitioners here. So let's start off by setting the stage a bit, and I thank you all for being here. Before COVID-19, there was ample research on the importance of prioritizing mental health for learners. Dr. McDonald, how does mental health impact a student's ability to learn?
Thank you, Asmeret. I'm so glad to get to be here, and I appreciate everybody joining us to get to talk about this topic. Personally, as a mental health counselor myself, I'm always eager to get to talk about mental health counseling because I think engaging in these kinds of conversations can go a long way towards taking down some of the stigma that exists around speaking about mental health and specifically also speaking about how we get help to address our own mental health and well-being. I think it would be helpful before we get into talking specifically about how mental health impacts the student's ability to learn, that we come up with a common definition by what we mean when we speak about mental health. For a lot of people, there's a confusion between mental illness and mental health. But when we talk about mental health, we're talking about something that's very broad, and it goes beyond just the absence of mental illness. So I personally like the World Health Organization's definition of mental health, and I'm going to read that here just to kind of create a foundation for our conversation this afternoon. Mental health, according to the World Health Organization's definition, is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So again, it's not just the lack of mental illness, but how we handle stress is a really big part of that definition of mental health. And there are plenty of reasons that we are all experiencing elevated stress levels right now. So that goes for kids as well. And we need to be thinking about how we actively create plans to work on, attend to, and address our mental health. It's not something that just happens automatically. When we think about the space that we're in right now, you know, we're all feeling a little bit challenged, and there's a lot of different emotions that on any given day we go through all at once. And this is the same for kids who are trying to learn in this environment as well. So there's been both a lot of anxiety about the start of school and returning to a virtual classroom, perhaps for the first time or perhaps after not so ideal experiences in the spring. But there's also excitement about what's it going to be like, is it going to work, getting a chance to see fresh faces again. So we're feeling joy and anger. We've got disappointment and hope, with fear, dread, frustration, anxiety, all of these things at one time. And those factors can absolutely inhibit a student's ability to focus and to learn. So in addition to these circumstances that we're living through right now, under pre-COVID experiences and certainly continuing through COVID, we also have a number of students who are in our schools that are experiencing adverse childhood experiences, things like trauma, which can include exposure to abuse, to violence, experiences of poverty, loss of significant relationships. And there have been some studies that place numbers of students who have been exposed to these types of experiences as high as 53% of the students in our schools. So we're dealing with kids who have a lot going on right now. And those kinds of issues absolutely can impact a student's ability to concentrate, to focus, to come to school prepared to learn. So a school is a place where we can both address those concerns, get access to some interventions that can support those, but it can also be a place where we do prevention and promotion of positive growth and development. Dr. Whitehead might be able to speak a little bit more to that than me, but as an educational leader, you know, you're attempting to create an environment that brings out the best in the child. And if mental health or mental illness or adverse childhood experiences or too much stress become a barrier to creating that environment, then absolutely we want to treat those.
Thank you for taking a deeper dive into that term of mental health and breaking that down for us much deeper. Dr. Whitehead, would you like to add anything from the students' abilities?
Well, I definitely believe that definition about the separation between mental illness and mental health is really, really necessary and clear. Thank you very much, Dr. McDonald, for sharing that. I think the mental energy, the distractions, the trauma, and we've started a lot heading into this year and last year, talking about trauma-informed teaching. Our students have many students have lived a full day before they would ever arrive to school, and being cognizant of that and be able to employ strategies and work in that direction to support not only the students, but the families. And if the students are expending mental energy long before they ever get to a classroom, it can have create a deficit when trying to understand or set your schema for language art strategies, have a visualization or picturing in mind, or especially if you're like third or second grade and you're beginning to understand basic facts or multiplication table, something as simple as that, your working memory can be affected. And, you know, let's talk about sleep quality. And I'm not gonna spend a long time with it, but if your sleep is disrupted with anticipation, anxiety about what the next day is going to bring, whether if you're home in a virtual environment and you have someone or unstable household where there's high frustration, external noise such as yelling or verbal abuse or frustration that is shared or that becomes mirrored, and that it becomes a heavy weight for the child. And so you don't know what's going on. It's also that eggshell environment that can be very difficult to navigate, and that can have a significant impact on a child's ability to navigate their school day, their learning experience.
Thank you both for that. While we're on the topic of before COVID, there's been an increasing demand in the past few years about the importance of enough school counselors to match the needs of students, with many low-income school districts with no school counselors or just not enough. Dr. McDonald, can you shed some light on the importance and the role of school counselors, especially right now?
Yeah, definitely. I think you're absolutely right to talk about the number of school counselors that are or are not available, and I want to share a statistic on that. But first, as far as understanding the school counselor's role, school counselors are a really important part of the educational leadership team for this school, and they help in a lot of different ways. One of the most important ways is through individual one-to-one services with a child, but that is by far not the only way that they help. They also provide group intervention, group counseling, group support type services, and they go into the classroom and they can provide lessons that help promote and teach students how to enhance their own social emotional well-being. But I think one of the most critical roles that a school counselor plays is to be the expert in the building on social emotional wellness and figuring out how to help the school principal, to help the teachers, to create systems of that where the school becomes a place that that kids learn to manage their emotions. They learn to be able to interpersonally relate with each other. They are academically achieving to the best of their ability, and they're getting ready for college. They're getting ready for careers. A school counselor is a really, really critical person to help design the type of environment that can make all of those things happen. So that being said, to speak a little about the lack of capacity that a lot of schools face with regard to school counselors on their staff, there's an organization, the American School Counseling Association, that's like the national organization for school counselors, and they suggest, based on their research and their years of experience, that the ideal ratio is a 1 to 250 student ratio. So for every one school counselor, there would be 250 students. But nationally, our average is almost double that. So we're at a national average in the last statistic available on that for 2018-2019 of 1 to 430. That means school counselors are spread a lot more thinly than what ideally, to be able to function and do all of the things that they're capable of doing, they're just spread too thin to be able to do that as effectively as they need to. I also want to take a moment to distinguish between what a school counselor does and what a school-based mental health counselor does. So a school counselor can be an important level of intervention, but when it comes to diagnosing and treating individuals, students who have a mental health disorder, having a school-based mental health counselor is another additional important team member for that school. And the school counselor can actually refer to that school-based mental health counselor. As I mentioned earlier, there's a lot of kids that are exposed to childhood experiences that make it tough and challenging for them to optimize their development, to come to school ready to learn. There's a lot of stress that we're all experiencing. But additionally, we do have 1 in 5 children who are likely would be the experiences that those 1 in 5 kids are experiencing are consistent with a diagnosable mental health disorder. So out of the 52 million kids that are in our United States public schools, there's 1 in 5 of them are experiencing a diagnosable mental health disorder. So having both of those team members, the school counselor and then also a school-based mental health counselor would be great. But unfortunately, a lot of schools through funding and resources and inequities in our system, which I think we'll get into a little bit later, not all schools are able to provide that resource to the optimal ratios.
Thank you. Thank you for clarifying that also of the role of school counselors and mental school counselor base. Dr. Whitehead, from your viewing lens as a principal, how are some school districts offering school counseling services virtually?
Well, just to touch back on what Dr. McDonald was saying about the deficit in school counselors being able to exist, or I still have colleagues out there who, when they tell me that they don't have a school counselor, and I've been in 3 states and 5 districts, and I just like, did you really just say that? You don't have a counselor. How do you go about this work? Because there is a heavy weight that is carried And the ratio, again, we're living it. I'm in a place where we have a counselor and we're at 600, roughly 600 students, or a little less. There's some buildings that over 700 have one, or 900 students that have one, or 1.5. And I've had the opportunity at one point where at a middle school level where I was able to have a community counselor, which served as a mental health counselor, and we had a building counselor. We had four guidance counselors as well. So we were very fortunate in that capacity. But even so, usually the community counselor, the mental health counselor came in through a grant-funded situation. So it's something that wasn't really sustainable. I wrote down a list of things of how our school counselor provides services in this time. We'll make sure, and the list is quite extensive. I know right now ours is providing a small group virtual meetings based is targeted, so it could be children who live in double households or families are separated, students who come from maybe abusive background or anxiety groups. So they're running the small groups. One-to-one services for the monitoring of 504 accommodations, just following up to make sure those accommodations still happening online, the modifications to assignments and tasks, or positive behavior plans or incentives, trying to help families navigate through those pieces as well. Also, use of social stories, trying to get students to understand and navigate some of the difficult scenarios are part of the plan and used by our school counselor. Making connections with services for families. So it's usually families are just unaware or through frustration, can't think rationally, try to figure out where to go for services. It's not always the hospital as where you might first think, but if there's child guidance or connecting with our district social worker to make sure we team up to find the appropriate support for families, that's going on. In these times, I know John Maxwell talks about in times of crisis, you're stop doing business and start building relationships, focus on relationships. So my school counselor is very key, as many counselors are very key in maintaining relationships with families. When families are in crisis mode, they're irrational, they're upset, they're fearful, and that's all to be understood. And our job is to be that sounding board. And from a school leadership standpoint, for our principal, we have to serve as buffers for our school counselors to make sure they're not involved in discipline, they're not involved in those pieces, but they're there to, I used to have a phrase or refer to them as the care bear of the school. Because if they're coming in a disciplinary standpoint when a child is struggling, then that trust is broken if you want that person to sit down with your school counselor. Also, just the teaching guidance lessons virtually, and then those ad hoc moments when you need your counselor, whether it's looking at scheduling, when we're scheduling courses or taking a look at what's going to have a maximum effect for students, that's still a large part of it. And then our counselor is a part of teacher, principal, and staff mental health as well. Those moments when you have an expert in-house is willing to listen, that could go a long way. And then the last piece is the sharing of many educational resources. We're fortunate enough to have a counselor who's experienced, but also contributes to our community and abroad and her expertise. So we're very fortunate in that way to be able to do that. But again, the fact that there's so many people without is devastating to hear, and it's something that must be addressed.
Wow, after hearing from both of you, I realize even more that school counseling services is more of a holistic approach. So I thank you both for shedding light on the continued importance of school counselors and examples of what districts are currently doing within the virtual environment. Okay, in the absence of, or sometimes in addition to counselors, often the role of recognizing mental health issues in students falls on teachers. Can you talk a bit about how teachers play a role in students' mental health and how that has changed over the past several years? Dr. McDonald, can you begin?
Yeah, sure. I did just want to add something to the previous question too. Just from a personal note, when we were planning to talk, Jarabri and I were mentioning that we both come to this conversation as educators and as leaders in our areas, but also as parents too. And just yesterday, my daughter participated in a virtual school counseling session. She's new at her school, and the school counselor convened other new kids in her grade to come together in a Zoom session. It's so important for there to be a place in the school where someone is thinking about all of those things. And to kind of fold that example into this next question, teachers have a lot of responsibility. They have a lot on their plate, and it can feel maybe sometimes overwhelming to be thinking about that they have a role to play in their students' mental health needs. But in fact, I think it's actually it can go the other way around for teachers to think about how important they are as a member of the school team that is thinking not only about student achievement, but also about student mental health. Teachers are spending a great deal of time every day with kids, and so they're seeing things. They're seeing those early signs, those early changes in behavior. Maybe it's more acting out, or maybe it's more withdrawing. And so they're able to see those things on a day-to-day basis, sometimes at a higher rate even than parents do. So what we need is to harness that lens that the teachers have into what's going on for a child and equip our teachers with the skills that they will know how to stay in their roles as teachers. We don't want teachers to become mental health counselors, but to, within their roles, be able to identify things that are early warning signs and then be able to pull in other team members that are more suitable to go to the next level. But teachers can also go a long way in creating a classroom environment that that includes trauma-informed practices, that pulls in some elements of trauma-informed practices to create a learning environment that supports mental health. And Dr. Whitehead was mentioning about the relationship. And so, teaching it's all about a relationship. And when that relationship includes trust and empathy, and kids feel seen and heard, all of those experiences of showing up every day, whether it's online or whether it's in the school building, and feeling seen and heard and validated, that can create a level of protection against the stressors and the strains that come from day-to-day living, but also to be a bit of a protective factor for kids who might be more susceptible to mental health disorders as well too. So teachers, I think, just play a really, really supportive role. When I was looking at coming to St. Joe's as a new employee, one of the things that really impressed me was that St. Joe's was already in this space. And I think that we've been kind of out ahead of a lot of other teacher preparation programs when it comes to equipping our student teachers with the skills that they need to be able to feel comfortable in that role in their own classrooms. So we at St. Joe's will have our education majors participate in an evidence-based training protocol that's called Youth Mental Health First Aid. And this is a program that is, again, it's not turning teachers into mental health counselors, but it's helping teachers to feel prepared that they can have, that they'll know how to respond if they see something in a child that's of concern, that they'll know how to respond in a crisis. And part of that know-how is, linking back to our school counselor conversation, is being able to have referral sources right there in the building to be able to tap into. So that's one thing that I think teachers benefit from is getting trained and being able to have a baseline mental health literacy understanding for themselves. Another important service that we provide with our education majors at St. Joe's is Qpr training. Qpr training is another evidence-based practice that comes out of Washington State, and Qpr stands for Question, Persuade, and Refer. So our students receive this training that gives them these basic tools about responding to a student who might have a suicidal crisis, or a coworker who is experiencing a suicidal crisis, or that someone is concerned that they might be thinking about suicide. And through a series of role plays and educational sessions, the teachers who take that training, they learn how to implement those steps: asking questions, persuading people to get help, and then referring them to an appropriate referral source. So I mean, it's all about education, and there are tools out there, and it's just a matter of taking the time to include those tools in the curriculum of training and preparing teachers that are entering the workforce, but also getting those teachers that are already out there in the workforce and helping them to benefit from some of these tools that are out there. And on that point, at St. Joe's, we're one of 7 universities in the state of Pennsylvania that offers a social emotional behavioral wellness endorsement certificate. This is where already licensed teachers can come in, take a series of classes. It counts towards their continuing education credit. It can be applied towards a degree program, and they get an additional endorsement on their teaching license that says, yes, I have this knowledge, I have this expertise in social, emotional, behavioral wellness for the benefit of my students. So I think just really leaning in on educating teachers and other school professionals to be informed about best practices.
Thank you. Dr. Whitehead, would you like to add anything from a school perspective?
Absolutely, and I can, Dr. McDonald, I wholeheartedly agree about the relationships. We can't even overstate any way, shape, or form how critical relationships are. Anytime I had the opportunity to speak to students K to 12, but I'll even focus on at the high school level where I've gone to high schools and had opportunity to speak to an auditorium or a small group of students. And one common thread was relationships. Students will literally attend to their schedule, attend to their effort based on the relationship that they have with their teachers. Whether it's at the high school or a block schedule at a high school. Think about if you have a block schedule at a high school and you have 5 teachers, but only 2 of them you really like or can engage with or feel like you can approach, that means you're spending a good percentage of your day feeling like you're unable to be your whole self. Or you don't have a relationship, you don't have an advocate, you don't have an ally, you don't feel supported in that way. And then you think about if you have a high school that's still in a 9-block period or 8, so you have 7 different adults or a number of adults that you have to navigate relationships with. That leads to avoiding class, that leads to cutting class, that leads to effort, that leads to being willing to ask questions, that leads to learner self-concept. Because in terms of relationships, usually outside of school day, there's not a great amount of conversations with families in the household speaking about in depth how a child sees themselves as a learner, what's their self-concept as a learner. Usually that comes from the school. Usually outside of school day, again, Angela pointed to the fact that having children, being a parent myself as well, is, we pick the kids up from school, we have soccer, lacrosse, basketball, wrestling, we have all these things and we're on the go. So usually I think you drop your kids off. So usually you're asking, did you do your homework? Is it done? Any questions? Can I support you? But that kind of hurried existence pulls you out. And unfortunately, except in these times, we have the benefit of being at the dinner table with our children. It definitely has made a difference. But going back to the idea of being educated and being aware and have opportunities to learn and unlearn, we had an opportunity here to engage in responsive classroom practices, really paying attention to culturally responsive classroom as well as Zaretta Hammond's work on the culturally responsive classroom about being allies for students, focusing on student needs, really having a knowledge of a student. Even if you don't have that, the Danielson framework that's there, one of the key components of knowledge of students. So if knowing your students, knowing your people is the only way you can serve your people. Positive adult language, that is a struggle for all of us. If you can get your children, and I heard this before, if you get your children from the house into the automobile without any kind of inappropriate words, then you're a saint or a monk, one of the two. Either way, you have that. But positive adult language is just your external voice becomes your child's internal voice. So that's very critical. We need to mirror for our children and our colleagues, especially teachers with their colleagues, need to mirror what that person should see in themselves. Because sometimes it takes another person to see the greatness in you, because when you're dealing with fear or anxiety, you may not see it, or you might dwell in some self-doubt. And also the point of being respectful to student differences, acknowledging who they are and not throwing a blanket over them and just treat them all the same. We have to acknowledge. It's amazing. I remember we had a student who Whenever she came to school, she would come to school, it's a middle school level, so come to school and her hair was a wreck. To me, that we learned that if her hair was a wreck, that meant that she was up all night with a very young puppy. And also she had mismatched socks that she would wear. So if you are at the door and you're looking at this child and you know this child, you pick up these little cues, is amazing because now you feel validated. There's this work by Obita and Till. They were doctoral students who wrote a book called Because of the Kids. And it spoke about the language and relationship building and the impact that has. But go back to also vulnerability. Sometimes if you get caught up in content, and sometimes it happens more so if we focus on just the standards and driving forward and pushing them through. If you focus on just the content and not the personal story, there is so many times over my career, and I'm quite sure anyone who's been a teacher, educator, therapist, anyone in those roles, that it is the timely story that child remembers over decades more so than the actual content lesson that you learn. So that means that we play such a significant role. And teachers also, again, it's a heavy burden, but they belong, and we're working through the belongingness work, basis training, making sure that everyone has a place. We're paying attention to the cultural issues for our students and what we are facing in society right now, and giving students voice. So that's so critical, respecting all aspects of the child. And then the fact is that our teachers in the classroom can be the place of stability. They know children come to school, they may be involved in a breakfast program. Your cafeteria supervisor may be a leader in that role because they may greet students. The bus driver, you have our head custodian who is singing when people first meet her in the morning. So you have all these pieces, but it's the students know that there's a schedule, they know the temperament of the teacher, they pick up on those things, and that helps regulate, self-regulate. It helps with self-regulation, understanding, and awareness. But again, the teachers we're in a place where we're emulating strategies, emulating the kind of person that the children, we want them to be able to become and how we want them to see themselves.
Now, thank you both, because in this conversation, and I know Dr. McDonald is going to add one more piece, that you're sharing a perspective from a parent, which is amazing because we have parents in attendance. So I thank you both. And I'm going to turn it back over to Dr. McDonald.
Yeah, I just wanted to add to that. Dr. Whitehead just mentioned it is a heavy burden, and I want to speak a little bit to that piece. Because just like we are coming to this role with multiple hats on, parent, educator ourselves, and so on, the teachers in the classrooms are wearing multiple hats too. Many of them are parents and caretakers themselves. They may have someone who's recently been really closely impacted by what's going on with the pandemic right now, as we're all impacted, but there may be a more closer impact. So I just want to acknowledge that it is a heavy burden, but it's important and it's worthwhile. And we get all these messages to attend to test scores and measures of student achievement and things. And it's so refreshing to hear a principal saying, hey, also pay attention to that relationship too. So I appreciate Dr. Whitehead's words there as well. And I think we need the reminders to really lean into that space where we're promoting and focusing on relationships with kids in the classrooms and educators. So I look at teachers as a part of the helping professions. And in the helping professions, we are often people who are so focused on taking care of other people that we forget to take care of ourselves. And so in the midst of all of this, and in the midst of all that teachers have been doing over the last couple of months to convert their materials, to work in a different space with their colleagues, to have the relationship with the principal, it changes when you're virtually connecting. Every relationship is changed, and here we are talking about really leaning into that space with the kids' relationship. I just want to put in a plug for self-care. It's such an important part of my profession. Being a counselor, we have to always remind ourselves to practice self-care. And one of the things that we say that I think is true for teachers as well is that self-care, it's not a luxury. It's not like the icing on the cake. It is the binding ingredient in the cake. And it's not a luxury, it's a necessity. So make sure that you're putting yourself at the top of the list so that you can be practicing that self-care and then go into the classroom, whether that's virtually or hybrid or whatever it may be, and start to do some of these really challenging things that we're talking about and to face some of these difficult circumstances that our kids are experiencing too.
Thank you for that tip.
Can I echo that, or because there's so much there? I don't know if the next question leads to that, but just the self-care standpoint is definitely just so critical, because in these times that our teachers are, whether are expressing how late they're up to be able to make the videos, to be able to just reach and connect with families. So there's so much there. So yeah, that's a great point.
Thank you, Dr. Whitehead. So at this point in the conversation, we'd like to launch our second poll. Do you feel that inequitable access to and varied familiarity with technology resources for online learning impacts students' mental health? Oh, wow, look at this. We have about 90%, 96% of our attendees already definitely agree. So we definitely agree that there's inequities in access. We have some attendees, about 3%, that think probably. So thank you for sharing that. So we know that it's evident in our role today within education and mental health. We're now going to go to our third question. The pandemic has highlighted many inequalities in our system that unfairly impact those with lower socioeconomic standing, with the education system being one large player. Dr. McDonald, what are some of the effects of these inequities in education on student education and mental well-being and success?
This is a huge question. So there are so many ways that these inequities impact the students' education, their mental well-being, and their success. It's almost overwhelming to even think about how to unpack that question in one webinar. But I think where I come to this space and thinking is really focusing on that mental well-being part. And I want to say something positive that I've seen happen. I participated in a webinar recently where Superintendent Height was sharing what some of the practices in the school district of Philadelphia were, and Dr. Whitehead might be able to speak to some in his district as well. But while there are a lot of inequities, the efforts that have been made to try to expand access to wireless, to be able to put Chromebooks in households, these are fantastic efforts, and I think they're going to forever change how we look at the resources that our kids need to start school, whether that's starting school online or starting school in a classroom. So it's been a struggle, and there are kids who don't have the resources to engage with all of the supplemental learning activities that other kids do, but that has always been there. It's just the pandemic has kind of put a spotlight on it. It has exacerbated a lot of these inequities, and it's calling our attention to act. So I know I personally I can feel overwhelmed in thinking about this question, but so if I'm feeling that, I'm imagining that I'm not the only one that's feeling that as well. We can't just look at our schools as the place to solve these inequities. It cannot just be the school, whether it's the individual school or the school district's responsibility, and certainly not the school principal's responsibility to address all of those inequities. This is a societal problem. This is a public issue that we need to be looking at how we strengthen community partnerships, how the neighborhood businesses around our schools engage to support our schools, what types of services we can provide through cultural and recreational centers. It's kind of an all-in effort, and the pandemic has only just kind of shown a spotlight on something that's already there. So I think, again, the work that's been done to try to expand access to online internet connection and internet connectivity and to be able to put some hardware in the hands of families is really good. And it's been a learning process. You know, it's only been 6 months, and we went from March of thinking one Chromebook per household to then realizing, no, there's multiple kids in that household and we need multiple Chromebooks or whatever the tool is that is being used. And so we're learning at a rapid rate. It's not enough, but there is progress that is happening here, and I don't want that to be lost. On the mental health side, it's remarkable to me how much people have engaged with telehealth and telemental health, and how school counselors and school-based mental health counselors and school social workers are learning to operate in that space as well. There's a lot of positive research showing that we can have positive outcomes in delivering services virtually for mental health services. And so I think there's still a lot to be done, and we need to retool ourselves and learn the skills that will make us effective in that type of delivery. But it really does expand access to care. For some people, they're more comfortable engaging in online counseling than they might be going face-to-face. And for a lot of people, it means they can interact with a counselor who's maybe farther away from their immediate community, and that might help provide a little bit more comfort around issues with stigma as well too. So I think people are jumping in, and I'm glad to see that.
Thank you. Dr. Whitehead, would you like to add anything?
Sure, and I know Angela and I had a conversation about stigma, which I hope we get a chance to share with you guys today, because I think she's got great feedback on it. I'll give you a brief story. Imagine some of the inequities. So when this pandemic, March 13th hit, and we start looking at technology, and we already talked about the number of devices. So I know we had a family with 6 children, 6 school-aged children. So you just thinking about getting those devices in their hands, whether we have enough devices or not. I think there were some misconceptions, as there often is, especially in the suburban areas, some metropolitan areas as well, that Wi-Fi is everywhere. But what's not taken into account is the bandwidth, the age of the equipment, the speed, how many devices affect the bandwidth, the ability to get on and off, teacher understanding or knowledge, because nobody's becoming an informational technology specialist overnight. It's not happening. It's not happening in 10 weeks. It's not happening in 1 year. It's not happening in 2 years. I've been in districts where we've had one-to-one iPads or devices for 5 years. And it took at least 5 years to be able to successfully and become proficient at that. So we're definitely in a phase of learning. And just think, I'm in a household. It's my wife who is a researcher. She works with Penn. She works in research at Penn. I'm in the house at times to help out because she has conference calls and our children are on their devices. We have 2 children. I watch my 3rd grade son, who is trying to navigate his device, and the links aren't working, and the teacher can't hear, and the platform is not working out as best as it possibly can in that time. And I watch, you can hear the hyperventilating happen. You can hear him getting upset. You can feel it. You can see it. And then his head is down on the table. Tears are pouring out. And he loves school. And both of my children, love school. But in that moment, what happens if I'm not there? What happens if my wife's not available? What happens if no one's there to help that student navigate that? So fortunately, I'm there when I can be, and I'm making sure he's able to get back up and running, and then we work through the emotions, and he's able to re-engage at school. But then even inequity in that, what if there's a child who gets mud-mined, or a child who struggles, or a child who can no longer attend? So that's a significant piece. Then there's those children who families do not have the daycare or can afford the quality of daycare. And even if a child is at daycare at a YMCA or a place, they're with a daycare provider, not with a certified teacher helping them navigate their learning opportunity at that time. So there's definitely so many inequities right now being felt, but then there's also the safety factor. If children are not able to successfully navigate the technology or access or have that kind of learning opportunity, then there's the risk of fear of whether the consequence of being in a particular kind of neighborhood that could be violence or in the home. So there's definitely, and we could do there's a whole nother episode series that you could do on this topic. We'll stop right there.
Thank you both. Going from inequitable access, let's go to another topic that's an issue greatly in 2020. Aside from the pandemic, this year, our country has faced head-on issues of racial injustice. How does this add to any feelings of anxiety or mental health issues as we return to the school year? Dr. McDonald?
Yeah, sure. So, well, I think in a big way, it just contributes to the emotional exhaustion that we've alluded to in this webinar and that many people are feeling. It's another source of feeling fatigued from discrimination, from microaggression, from injustices that have been long-standing but are being more illuminated, more brought out into the media. And one of the things that I think is, one of the things that comes to mind has been the videos that have shown brutality and violence and things, and those have circulated, and the toll that can take. And it's a different type of toll on different people. It can hit people differently from watching these videos or just knowing that the videos are out circulating, from thinking about, this is happening in my neighborhood, or this could be me, this could be my son, my daughter, or also tapping into feelings of shame or feeling guilty and not really, a sense of helplessness of what do I do? What can I do for my space? This is so horrible. So I think it's an important moment that we're at. And as we talked about with the technology inequities, I mean, this pandemic is really just putting a strain on our system and bringing out these things that have been present there. And I'll speak to the system of mental health care here. There have been problems within the system of mental health care that where discrimination and oppression are felt more or have been ignored by helpers when those things come into the counseling room. And so there's a call within the counseling profession to do a better job of acknowledging, addressing, and dismantling the bias that is inherent in a lot of our systems. So what that looks like, I think I've been talking about, encouraging people, kids and parents and professionals to go out and get counseling. And a lot of people want to go see a counselor who looks like them, who they feel like is going to be able to relate to them, and who they feel like they can trust and understand. For me to think about finding someone that looks like me as a white woman, it's pretty easy to find another white woman counselor because the profession is full of them. For a person of color, a person who has a different identity, it's going to be a bit more of a challenge. But research does support that having those kinds of connections in a counseling relationship can enhance the therapeutic process. We can get positive outcomes when we're able to connect with people where we kind of expedite that process of understanding and trust. So we need to be doing a better job of training our professionals to be able to work with people who are similar and different, to be able to challenge systems that have worked against the progress that we try to make in the counseling room. And we also need to be continuing to recruit into the workforce pipelines for teaching and for counseling and other professions, a more diverse workforce. So I think for those folks who are already out in these professions to think a little bit about the issues of racial justice, it's a matter of just continuing to get comfortable with being uncomfortable and challenging yourself and pushing yourself and having honest conversations and being open to kind of re-educate yourself that some of the things that you've learned have been through a lens that hasn't represented everybody's experiences. So I'll pause there.
Thank you, Dr. McDonald. Dr. Whitehead, would you like to add anything?
Sure. I think that we do have a moral and ethical duty to make sure that we understand the layers that are there. Representation does matter. And that's what Dr. McDonald was pointing to and the impact of that. I mean, it took 45 years, I'm 46 now, it took 45 years till I saw my name in print. There was that book, Jarabri Jumps. Yeah. And just seeing that book, and I have it now at home, but just seeing that book in print, So something as simple as not being able to go to the amusement park and go to Hershey Park, you go and you got the keychains, the souvenirs, you see a whole rack of names, and you never see your name. You never see it. And it may be something small, but it's about inclusion. It's about acceptance. It's about seeing yourself in a positive light. And then with the idea that, you know, in our times is frustration, or what happens is you're not able to be your whole self. You're not able to live wholeheartedly. So you're in a world where you're questioning your self-worth because of, you know, look, I'll be honest, and I shared this on a video before, but there was once the situation with George Floyd occurred, and I've been aware and obviously grew up in neighborhoods where I've seen so much. But at the same time, when that occurred, May 29th of that, seeing that video, that disrupted a significant amount of sleep and sense of being able to feel value. So how does that play itself out? So we go into these meetings and we talk about COVID, and we talk about the work that needs to be done. We talk about caring about other students. And at the same time, as a father of a you know, socially labeled brown child, that we end up, I'm worried about his safety. I'm concerned about my own safety. But you then have to uplift yourself, remember who you are, and do the inner work to then go ahead and lead a community, to be able to be a leader for a school, your school building, to make sure you manage and support your teachers and the families that you're with every day, because you know that work is really important. And I'll give you just so simple how these little things happen, the microaggressions that Dr. McDonald pointed to, and that way. So you come back from the gym in the morning, you got a great start to the day, you meditated, you did gratitude journaling, got your routine, and then you're getting your car, you're driving, and all of a sudden you notice that the truck that pulls up in front of you has a Confederate flag, it has all the, you know, the flags possible and the guns, as much as possible. And then you start seeing, well, that's that person's belief system, and I'm sitting right behind. I got to look at this at the light for the next, you know, whatever amount of time, and so you see that. Then there's so many other stories or cases. I've had the opportunity to meet with police officers at roll call to talk about the impact of the microaggressions and the weight that carries, and think about that for our students. They're coming to school with broken trust. They're coming to school with the generational trauma, the passed down of a struggle that comes along the way, inherited stress. That, I don't know if you ever saw the movie Fences with Denzel Washington. He's a father in that movie. He was a former baseball player. Now he's working at a plant because, you know, he doesn't have the opportunity anymore. He got older. He's trying to raise a child, but he's trying to raise a child as a Black father in a world that doesn't really value him. I've come from a line of military grandfathers who were in the military who also were not able to be honored. They used to be threatened because they wore their uniform back home because they weren't considered human enough to wear that uniform, or they saw the flyers of themselves as monkeys in Germany or France when they served, to demonstrate that to help people understand that these were not humans wearing these uniforms to serve in the country. And again, those are passed down. Fortunately for me, I have the support networks. But for schools, if we in these times are able to acknowledge these topics, there's teaching tolerance, which is a great resource to provide for families to read and utilize. But it's that comfort level for teachers to be able to be engaged in that, the comfort level for parents to be able to engage and make sure that we learn more. And then, the schools will benefit at this time, as far as this, benefit from a focus on total health. We have the COVID environment that we're in. We have the mental health. So it's really time for a Get Healthy initiative for all of us. So as far as the weight, the weight is there. I think we do a disservice by skipping it and not acknowledging it, because if these children are coming into the classroom, or the children or adults even are going into therapy, if we're skipping that piece, as far, the term elephant in the room, then we just continue to perpetuate that story and damaging mental health further.
Thank you both for this deep, meaningful conversation. We touched base on mental health, the true definition of it, and equitable access, the importance of school counselors, our race, everything that was needed today. So I thank you both. I would like to close off with final thoughts. So I'm going to ask Dr. McDonald, can you just start any closing thoughts that you would like to give to our attendees in our webinar today?
Well, my closing thought is it's been such a delight to get to participate in this and to learn from Dr. Whitehead's experiences and hear them. And I know that the people who are listening in on this webinar are benefiting from that too. So I appreciate that. And Asmeret, I appreciate your facilitating this dialogue for us. We have gone deep. We have covered a lot of really deep conversations in a short amount of time. So my parting thought is just to encourage everyone to tell their truth to themselves, to find someone that they can tell that truth to other than themselves. And if you don't have someone in your life that you can tell that truth to, then to consider counseling a space to do that. But I think that's really at the foundation of our ability to shore ourselves up and to enhance our mental health, to be able to then go out there and do the type of courageous work that teachers and educators and administrators and counselors are doing on a day-to-day basis, and that parents are doing as well. Because, making change on a one-to-one basis within ourselves or with the kids in our classroom or with our own children is really important. But eventually, we have to find the strength to fight or change the systems and the policies that have continued to support some of the things we've talked about today.
Thank you. And Dr. Whitehead, is there anything you'd like to leave our audience with?
Sure, Asmeret. And again, thank you as well for hosting today, and thank you so much, Dr. McDonald. I was writing down notes. I don't know if you noticed as you're talking along the way. So I definitely learned a lot today, and I'm looking forward to learning more from you as well. In these times, it really does focusing on the areas of control. I believe action kills anxiety, and the more than anything, to live that you can control 5 factors immediately. One is your sleep. Being able to control and focus on your quality of sleep, making sure that the technology is turned off, making sure that you're eating, your gut health is proper, that you're eating things that promote quality sleep. 2, movement, being able to move, exercise, getting out. It definitely benefits, whether it's outside, something consistent every day. It doesn't have to be a gym where you belong to. Is get out and move, walk. Get out of that sedentary mindset. Then nutrition, the way you fuel your body for your goals and the directions of your dreams. Being able to be good, to eat foods that are healthy for you, that love you back. I think is really, really critical. Mindset, and control your mindset. And we've talked a lot about reframing. In these times where we have these things we say we have to do, but what if we talk about that we get to do? And I was able to be home in these times, and my daughter, I was able to have lunch during the day with my child. I was able to go for a walk in these times. I was able to see them for who they are without the external factors. And then last one is relationships. We are a sum total of the 5 people we spend most of our time with. So who is your network? How do you show up for them? How do they show up for you? And the last piece is unlearning and learning. One thing I want you to unlearn, if you don't remember anything else, get rid of the generational story. Get rid of the stories you tell yourself, the negative concept about who you are. You don't own, like your family doesn't always have family doesn't always have a bad experience. Your family doesn't always have to have this always happens to us. Don't own that story. We get the opportunity to change and control the narrative. So we rewrite the end of our story, the reframing. And again, it's not easy, but it's going to be okay. And we should continue to work in the area. We don't have to win today. We just win one moment at a time.
I thank you both. As we close today's sessions, I'd like to remind you that a recording of this webinar will be made available at sju.edu/unlimitedlearning. I'd like to thank Dr. McDonald and Dr. Whitehead again for lending your time and expertise to today's conversations. Thank you to St. Joseph's University for hosting this event, and thank you all for your time, attention, and participation. Be sure to stay tuned for the announcement of our next installment of the Unlimited Learning Series on diversity in the workplace on October 22nd. More information will be shared soon on sju.edu/unlimitedlearning. Again, I am Asmeret Easley, class of 2010-2021. Stay well, stay connected, and this all soon shall pass.